Hi there, I'm Dr. Tara at the Lacey office of Thompson Healthcare. Today we're working with Amanda who has a headache. We're going to actually demonstrate a very unique chiropractic adjustment that deals with just one vertebrae and the upper part of her neck. So what we're going to first do is see if Amanda qualifies for that technique by checking her leg lengths when she's face up. So basically what we're going to do is we're going to bring her legs together and we're going to check to see if one leg is shorter than another. And here we can see that the right leg is about 1/2 inch to 3/4 shorter than her left leg. We're going to use some muscle memory. The body has this muscle memory that tells the body if it wants to be adjusted in a certain way by swiping on her atlas, which is her first vertebrae of her neck. We're going to first swipe forward, and each time we do that swipe, we're going to check her feet again. And as you can see, her legs evened right out. But we are still going to do the other 3 swipes just to make sure we have the best angle each time. So now we're swiping back. Sometimes it's a little bit tender, so I do apologize if it's tender when I push there. Legs did not change there. So we're going to try the other side. Again, we're going to push forward on now the left. And come on back down, check the legs. This time the legs actually got a lot worse, so we definitely don't want to utilize that way. Now we're going to push back on the left to check once again. And the legs still have not evened out. So that means the first swipe that we did was the one that works the best. So Amanda, come on and sit up for me. I'm going to have you face that wall. This technique is a little bit different because it utilizes a different piece of the table or adjusting tool. This is a drop piece made just for your head. It's portable, which is really great, so it can go room to room. And it can move, which is nice, so it makes it a little bit easier and more comfortable on the patient. So we're going to have this all set and ready to go. Cover this up. It's a very dynamic, specific adjustment, so we're going to have the placement be the same way, very specific. So I'll have you take this arm out for me, and I'm going to have you scoot your whole body a little bit to your right. Perfect, your whole high knee, there you go. Then here. We're going to take this, tuck it under this armpit, and then you're going to relax, uncross your feet. At the count of 3, we're going to go down on your side, uncomfortable side, not fall asleep side, and you're going to bring your legs up like you're going to bed, okay? So we're going to go down at 3. 1, 2, and 3. Those legs come up till you're comfortable. Good, right there, a little uncomfortable. Keep these bent so you feel a little bit stabilized, and leave this one right here for me. Wonderful. So we're going to move the table up just a tiny bit. Get all this pretty hair out of my way. The headpiece does pop up, so I want to show you how it's going to make a little bit of noise because it's going to be a little bit louder in your ear, just like that. Good. So we find that spot right on her atlas, which is a little outside where people normally think from the back. We're going to come right under the ear. Just going to take my watch off. Good. It's a nice, light, gentle technique, so it's really great for people too if they're worried about getting their neck cracked when they have a headache. And this is just going to drop, just like that. So Amanda's going to rest for about a minute, and what's happening during this time is her atlas is actually oscillating at a microscopic level, meaning it's shaking a little bit. So I don't want her to get up right away and be moving around. So while it's doing that, it's going to start to slow down. Very specifically, the body is going to put the atlas back where it belongs, kind of back in its cradle. So I'm going to help you up. Don't get up yet without me. You're going to grab the back of my arm. I'm grabbing the back of your arm, and we're just using our arms to sit on up at the count of 3. 1, 2, and 3. Good. How you feeling? Good. Good. So sometimes there might be a little bit of dizziness, especially if we're working with dizziness and vertigo. So we're going to have Amanda lay back on her back. So Amanda, you can go ahead and lay down. Swing your feet around for me. Give me your hand. Once again, just hands, and down we go. Good. So Amanda's going to rest. We're going to turn the lights out. She's going to have about 10 minutes, and after the 10 minutes is over, we're going to check those leg lengths again to make sure that we got the adjustment and that the atlas was properly back in its cradle. So Amanda's been resting for 10 minutes, so we're going to come back now and check her leg lengths again. So if we pull these legs back the way we started, and we look them and we balance them, the legs are nice and balanced. That means we've put the atlas back exactly where it belongs, and this is going to help with the headache.